scene safe. PPE, scene safe.
Yes.
Okay. My mechanism of injury.
Broken leg.
Number of patients.
1.
Okay, so I'm going to call for ALS backup, and I will consider C-spine. Then I'm going to go ahead and determine general impression of the patient, which is calm, pink, and a little diaphoretic. Next is determine level of consciousness. So this patient is speaking to me, breathing, so he's pretty conscious and responsive. And determine my chief complaint and any apparent life threats. So again, chief complaint, it looks like it's a broken leg, and we don't have any apparent life threats at this moment. So next is going to be my ABC. So I'm going to check the airway. I'm going to assess the airway, and I'm going to insert any airway adjuncts as required. And I'm going to go ahead and check breathing. My patient is breathing. I'm going to go ahead and check respiration rate and quality. And it looks like we have, what's our respiration rate?
15 respirations.
Okay, 15 respirations per minute. And I'm going to go ahead and initiate oxygen therapy if necessary, if required. I'm going to manage any injuries and make sure there's no obstructions that can deters breathing. And after that, I'm going to check circulation, making sure I'm going to check pulse. What's the pulse?
70.
70 pulse, okay, and make sure equal or regular pulse on both sides. And I'm also going to check skin color and skin condition. Looks like we have good pink skin color, and the skin is warm. After that, I'm going to go ahead and manage any major bleeding, and also initiate shock therapy if required. And then I'm going to go ahead and identify this patient as a code 2 patient. Gets low priority at this moment. So next is history taking. So I'm going to go ahead and check my patient's blood pressure. What's the blood pressure?
120 over 60.
120 over 60, okay. And then I'm going to go ahead and check patient's pulse. The pulse is
70.
70, okay. And then I'm going to check respiration rate and quality. Looks like it's still 15. Rate is regular, strong. And then after that, I'm going to go ahead and obtain a sample history, so signs and symptoms. So signs, just having, just looks like just a broken leg. Symptoms of it, just pain. That's about it at this moment. And then, is he allergic to any allergies? Does he have any allergies?
No.
Any medications he's on?
No.
Okay. And A and P. So any past pertinent history that we should know about?
No.
Okay. And last oral intake?
2 hours ago.
2 hours ago? Okay. And events leading up to the injury?
Playing football.
Playing football, okay. Perfect. So we got that taken care of. So next, we're going to move on to secondary assessment. I'm going to go ahead and check my patient sitting up. I'm going to go ahead and check my patient's head, making sure there's from the top back. I'm going to go ahead and palpate, making sure there's no injuries, no obvious signs of bleeding. I'm going to go ahead and check facial features. I'm going to go ahead and check the eyes, make sure their eyes are good with my light. I'm going to check the ears, back of the ears, and make sure there's no leakage. I'm going to check the nose, structures around the bone, structures in the face. And I'm going to go ahead and after that, I'm going to go ahead and check the neck, check the back of the neck, making sure everything's in line, nothing broken. I'm going to go ahead and check the front of the neck. I'm going to go ahead and check the trachea right here, making sure it's in line, it's not to the left or to the right. Then I'm going to check for any jugular vein distension, none at this moment. So after that, we move on to chest. I'm going to go ahead and palpate the chest. Good, making sure that the chest is good, it's not broken. I'm going to go and check the middle of the chest. Again, just checking the integrity of it, making sure there's no damage there. I'm also going ahead and check for lung sounds. My stethoscope. Alright, we have good lung sounds. It's clear. So next, after that, we're going to go ahead and check the abdomen. I'm going to go ahead and palpate the abdomen, the 4 quadrants, make sure nothing's broken, and then I'm going to go and check the pelvic area, the pelvis, again by pushing down, applying some pressure, making sure nothing's broken, nothing's tweaked to the side, and then I'll go ahead and check the genitalia, just by verbally asking my patient everything down there is okay. So we checked out, we're clear there, and then afterwards I'm going to go ahead and check. Next thing rather is I'm going to go ahead and check the lower extremities. So I'm going to go ahead and put my arms, check the legs in opposite direction, push pressure in opposite direction, going down. Same thing on the other side. Make sure this one's not broken. So his right leg's good. Obviously his right leg's broken, so I'm going to go ahead and just do it lightly, making sure there's only one fracture, making sure there's no more than one fracture. And then I'm going to go ahead and check the motor and sensory functions. So I'm going to tell him to push down on my hand with his foot, push it down, I'm going to tell him to pull up, and I'm going to tell him if he knows which toe I'm squeezing. And then I'm going to check upper extremities, same thing, put pressure on both sides of his arm in opposing directions, making sure nothing's broken. Okay, checked out there. And then I'm going to check the sensory motor functions by asking him to squeeze my finger and to tell me which finger I'm squeezing. So after that, I'm going to go ahead and roll the patient on his side, and I'm going to go ahead and check the buttocks area by applying pressure, making sure nothing's broken there. I'm going to go ahead and check the back, the neck is in line, the spine's in line, everything's intact, and I'm going to check the lumbar as well, make sure everything's straight. Okay, and so we have that. That's the secondary assessment. So everything checked out there, and I'm going to go ahead and reassess my patient since it's a stable patient, reassess my patient every 5 to 10 minutes, and give my all the information to the doctor as needed, and that's it.